Hello, Dr. Magdalene Kerschner for Victory Wellness and MedSpa. Welcome to our videos about supplements. So, daily multivitamins, take or not to take is the question a lot of people ask. So first of all, let's talk about which ones should I take. I believe in pharmaceutical grade supplements, and that's the ones I take. And what's the difference between this pharmaceutical grade from Salt Lake City, Utah that I get is that those are pure without any additives. So they made by a special pharmacy in Utah, and they don't have any talcum additives, silica, and all the other, even arsenic that is found in the ones we get from health food stores that are made often in China, unfortunately. So these are made in the United States in very clean labs, and they're pretty purified. And they have detectable, in your blood on the lab, detectable amounts of vitamins. So that's what makes a difference between pharmaceutical grade vitamins and just regular vitamins you get from your store. So back to daily multivitamin. Why take or not to take? So as I'm sure most of us have heard, we eat very processed foods, right? And how do we know we eat processed foods? Well, if you put a piece of bread, it'll stay on your counter for 2 weeks, right? Won't grow mold. Well, why not? If you get from organic bakery or organic bread or the one you're gonna make yourself, you'll notice that in 2 days it grows mold. So the reason is because of preservatives. Our foods have lots of preservatives in it, so they have a long shelf life. And you can see this with almost everything. You can see that your ham, when you buy organic ham, it will only last for 2 days in the refrigerator, it's edible. But the ones with preservative additives will last for about 7 days. So this is how, stores and food companies basically extend shelf life of our foods, or we would not be able probably to keep Kroger's open if everything was just gone in 1 or 2 days. So, but because we have all the preservatives, we don't have as many vitamins, because the longer something's on the shelf, the more it loses its vitamins and nutritional values. And I'm sure we've heard all that. It's kind of all over the news, and we hear about this all the time. So yes, most of us probably have some borderline vitamin deficiencies, or we're low. Maybe not like in the olden days where, it was sailors that were not exposed to fruit for weeks or months developed scurvy, and their teeth would fall out because vitamin C deficiency causes gum disease and rotted teeth. So we don't see this to this extent, but perhaps poor health of our gums has something to do with low vitamin C deficiency, because we don't eat the fruit we're supposed to eat. Or maybe the fruit we eat is, just been sitting on a shelf for a long time and has lost its potency and its vitamins. It's same with vitamin D and rickets, in children, where we used to see in the olden days, kids' bow-leggedness was very, very common. We don't see it as much today because everything's fortified with vitamin D, and the parents or grandparents would give the kids cod liver oil because it's very high in vitamin D in order to prevent or treat rickets, bow-leggedness. It was due to very, very soft bones, deficiency of vitamin D. Then we have diseases such as pellagra, which is B12 deficiency. You can actually become completely paralyzed, lose your mind from B12 deficiency, or Wernicke-Korsakoff syndrome, which is B1 deficiency, which we still see in alcoholics. People that drink a lot have vitamin B1 and B12 and folate deficiency, just because alcohol interferes with absorption of these vitamins. So we still see today in psychiatric units people with Wernicke-Korsakoff syndrome, which is dementia from B1 deficiency or thiamine deficiency. So some of us don't have that in such a high level, but if you drink all the time, maybe daily, you like to party, you like to socialize, that is something to take into account, that you might be having borderline levels of these vitamins, and it's not healthy for you. B12 deficiency, pellagra, it interferes with nervous system function. You can actually become completely paralyzed from B12 deficiency. So those are some various folate deficiency, birth defects. Mothers that are B12 folate deficient with spina bifida syndromes have been linked. So these are very important things. We're talking about bottom level deficiency, but I think most of us are just probably not optimized, and it would be good for our bodies to be optimized. So I do recommend multivitamins, daily multivitamins that are pharmaceutical grade.